Have you noticed that patients accept side effects of chemotherapy easily as compared to any complication, even minor complication from a surgery? At least they do it in a much better way. Often the rationale is that it's a systemic medicine, so systemic effects are bound to happen, which is true also. Even life-threatening complications are accepted in a less dramatic way. But I guess surgeons don't get that much leeway, even minute complications. Surgery is often viewed as mechanical part. You go in, you take out the tumor, you close the abdomen. That's all. So when a complication arises, it doesn't feel like it is part of a healing process or something. It's seen as a mechanical failure. And as a cancer surgeon, it feels quite disheartening. When a patient is started on chemotherapy, side effects like nausea, alopecia are incredibly difficult to cope with. But they are accepted as the proof that the medicine is working. One of my patients who underwent pelvic surgery few weeks back, she developed fever almost like 2 weeks post-op. Naturally, the family was frightened, and their first thought was operation has caused this. Our patient was fine surgery ke pehle. And this conversation is happening over phone, so your own thought process is going haywire. You're thinking any rectum problem, any ureteral injury, any intra-abdominal collections, wound infection. On further evaluation, she was diagnosed with typhoid and UTI. Obviously, she got better with the antibiotics. But here I learned two things. First, a proper informed written consent is very much important. Second, the family panics post-op. They will blame everything on you. So be prepared mentally. Maybe they are terrified because they're not questioning your skills basically, because if they were, they wouldn't let you operate. Mostly it's their fear only. Always evaluate the patient if they are having post-operative fever properly, because it can be n number of things. Give them grace, explain the biology, follow the clinical evidence.